So today I am so excited because on the podcast we have the amazing Melissa Larkins, who is a nutritionist, naturopath and medical herbalist. So thank you so much for being here, Mel, as always.
Thank you for having me again.
No problem. Now, today I'm very excited about talking about this topic because it's a huge topic, but I definitely don't think anyone is talking about it enough. And when I looked into it, I was quite shocked. And it's the topic of heart disease in women and how heart disease is the biggest killer of women.
Yeah, it's the biggest killer of women worldwide.
It's unbelievable. And I read that, is it right that 20 women a day in Australia die of heart disease?
They do, yeah, which is, about 3 times the amount of breast cancer in terms of mortalities. And we have a lot of, we're all talking about breast cancer and different cancers, but heart disease, I think, because it's kind of boring, to tell you the truth. So people aren't that interested in it. And for the most part, we've got great medications that do treat it. However, women aren't getting those medications at the same rate as men, unfortunately. So if we are to have some kind of heart involvement, we are more likely to die of it.
Well, I'm just astounded by it because it is something that, like, we do talk about cancers, and we should talk about cancers, obviously. We do talk about these things, but certainly heart disease hasn't been on my radar. Now, you say it's because it's boring, but surely from a medical perspective and a weight on Medicare and on all kind of medical systems all over the world, it's a huge weight. So why aren't the medics, why aren't the governments, why aren't people talking about it? Because surely if we talk about it, we can reduce it and reduce the financial load on the healthcare systems.
Yeah, definitely. I think there's it's multifactorial, right? It's from a base level, the clinical research that is done or has been done historically is primarily done on men. That means that the drugs that are created are primarily made for the physiology of men, not women. So we have, I guess, that under recognition at that base kind of clinical trial level, which means that there's not a lot of evidence for medical practitioners to then move forward with for treating women. We also present differently. So that means that we are underdiagnosed. A woman waits twice as long to get a base kind of medication in ED when she presents with chest pain versus a man. So I think we're more complex beings and we have a lot going on. And I don't know if there's some kind of confusion that happens because of that, where they're trying to rule out other things before they put forward a cardiovascular kind of issue. We are just as likely to get chest pain as men, but sometimes it's like that symptom is diluted by other symptoms like vomiting and nausea that we are really that commonly occur with a heart attack in women or with ischemic heart disease and dizziness. So those things are quite, they're quite common symptoms for lots of different disease states. So when we present with those things, the chest pain might be the last thing we kind of mention because we're quite unwell.
So basically what you're saying is the chest pain is when you're having a heart attack and when could be or probably is fatal. But at that stage, it's kind of, we haven't looked at it, we haven't addressed it. It's got so far that it's almost too late.
Maybe, or we don't have the intervention. So there's not that quick intervention of, oh, hey, they're having a heart attack, let's go in with a whatever type of medication or put a defib on or whatever that looks like for treatment. It's the symptoms are diluted because we have different presentation, essentially. We may not get chest pain too. We might not get jaw pain. We may not get the left arm pain. So we just don't present traditionally or with a single symptom in many cases, and that confuses the situation, I guess.
And because, I always thought, and correct me if I'm wrong, that women are better at taking care of health, right? And men are worse at it because men don't like to go to the doctors and talk about it and things like that. But is there something specific? Like, because like, for example, for me, I always go to the doctor at least once a year and get all my bloods done because I'm probably a bit paranoid, but I always think that, you know, there's things that I don't know could happen. So I think I go and get all my bloods done. I get everything checked. And I kind of think, well, if there's anything untoward happening, it'll get picked up.
Yeah.
I don't know guys really that do that. If you're doing something like that, is that something that would check up for something like heart disease, or is heart disease something that you have to go in and say, I want a specific check for that?
Your probably the blood pressure and cholesterol are our
Right.
top two, points of checking. There's a couple of things there. There's this persistent attitude, I guess, that CBD only affects men and not women, and that does kind of still prevail in medicine. There's also the sex differences in how we present. So the traditional blood pressure reading of 120/80 is already too high for women. So we are looking at, trying to put in these sex differences in baselines of where those things should be. So for women, we really are looking to keep that blood pressure below 110/80 if possible, and that doesn't seem like a lot. But if you present with, say, 130 or 140/80 or 90, that's still kind of, yeah, look, that's fine. And if you are already at risk at 120, then, we're already kind of like letting that slip through the cracks, if you like.
Yeah, okay.
The other thing is, because we are, I guess, underrepresented or understudied, women don't take, so even when they are not prescribed statins, which are for hypercholesterolemia or high cholesterol, they're not presented, they're not prescribed statins as often. And when they are prescribed statins, they don't take them as long for some reason. And I don't know if that's because women feel better or they don't like being on the medication, or
And sorry, can I just ask, statins, is that a medication for
yeah, sorry,
cholesterol
it's a medication that is given for high cholesterol.
Okay.
And then, like, I don't know why we're not taking that, but I think that it comes back to the importance being kind of solidified in that initial appointment of whoever prescribed them.
Okay.
So your cholesterol is high. This is, one of the factors that we can use to say that there's extra pressure on your cardiovascular system. Look, your blood pressure is also like 120/80 or 130/80. I like it to be a little bit lower for my female patients, and I'm not saying that GPs are doing a bad job. This is emerging evidence because we have not had women in our clinical trials to date, historically. So the fact that we don't have sex-specific blood pressure readings is not great. We don't have sex-specific cholesterol readings either. Women also, they present with heart disease on average 10 years after men.
Wow.
So it's a later diagnosis. It's a later age period. Normally, for women who have never had any heart disease issues or symptoms, menopause with the drop in estrogen can cause estrogen is really important for your endothelial health, and that's all the tissue that surrounds your vessels, right? So as you drop in estrogen, that endothelial tissue can become a little bit harder, not as flexible, not as pliable, if you like. So you then are more likely to have issues with that system. So the fact that we're on average kind of presenting with these symptoms 10 years after men also puts us in a different age category for risk.
Okay. And can I just ask, with obviously the menopause and the estrogen changing, does that issue you mentioned correct itself with phytoestrogens? Does that help that, or is that something that is irrelevant?
It might help it, but I don't know that it will be at a therapeutic dose that is enough to assist. There's some heart specialists that say that women should take HRT purely for that projective effect of estrogen for the heart if they have previous risk factors. There was some talk about HRT being an issue for the heart, the heart and heart disease and stuff like that. Apparently now none of that's true. So, I don't think we know what we're doing with women overall. We're just, we need better we need like a better base in place for checking our women, recognizing issues, diagnosing these issues, and then treating them, because we don't respond to the medication in the same ways either. The other thing is, as you have fluctuations throughout your life, like if you have any, you have a 2 to 3-fold increased risk of cardiovascular disease during pregnancy, because there's so much pressure on your
Yeah.
heart during that time. And then even when all of that rectifies, the risk stays. So
Really?
your blood pressure, your cholesterol, everything might be
Yeah.
fine, but the risk stays. So we know that there's this increased risk ongoing for the rest of that woman's life, having had those CVD factors during pregnancy as well.
Yeah, wow. How is that happening? Because if the pressure is on your body when you're making the baby, which I totally understand, when the baby's gone, isn't the pressure gone?
Yes, I think your blood, you have more blood when you're pregnant.
Yeah.
That's what puts pressure on that system. And I don't know the ins and outs, if we even know why that happens, but
Mm.
it's essentially that system has been put under extra pressure, and that
Yeah.
kind of
Okay.
affects it and remains long term. So those are the
So,
ladies that are more likely post menopause as well
yeah.
to have CVD stuff go on.
So, I mean, it's tough, right? I mean, we get it coming from all angles, don't
Yeah.
we, as women? It's really difficult. So, I want to talk to you about what we can do in the earlier years. But before we get on to that, I would love to know. So, if someone is listening to this and they, either do have high cholesterol or they do have high blood pressure, or they don't have any of those things, but are just menopausal
Hmm.
or postmenopausal, and everything you're saying is resonating, and the estrogen obviously factor is a fact. It's there. We can't run away from it. Is there anything we can do to help kind of protect ourselves or limit that risk of the heart disease?
Yeah, definitely. Exercise
Okay.
is key. And, the only contraindication for exercise is if your blood pressure is, say, 200, over 110.
So like
So
super high.
really, really high, the kind of high
Yeah.
that I have to run people to the ED for if I test
Okay.
that in clinic,
Yeah.
or call an ambulance for them.
And when
Um,
you say exercise, because there's lots of different types of exercises, obviously, like your gentle walking, there's your hit, there's the strength building
mhm.
weights. What type of exercise is best for
Yeah,
this?
look, I should get my husband down. He will be able to tell you more on that. But any kind of movement is good for the body. And exercise doesn't have to mean you go to the gym. It could mean dancing.
Hmm.
It could
Hmm.
be anything that's joyful and enjoyable for you. Yoga, meditation, whatever.
But do we need to get our heart rate up? Do we need to get a sweat on? Do we need to be out of breath?
I don't know. Yeah, I would have to ask him.
Yeah.
So I think, look, for me, any kind of movement is good. But if you're looking
Yeah.
to specifically reduce, say, blood pressure, then
Hmm.
an exercise physiologist is the person that you want on your team of
Yeah.
healthcare, because they prescribe exercise as medicine. So
Yeah.
depending on all of your factors, depending
Hmm.
on, what your goals are, what you want to achieve, what you're looking to treat, if you want to treat something with exercise, then the exercise physiologist is the person to see.
Yeah.
Any movement is great.
Okay.
The getting weights obviously are going to be great for bone mineral density and preventing osteoporosis into
Hmm.
menopause and postmenopause, all that kind of thing. Sometimes you can have contraindications to different types of exercise for a range of different reasons. So that's why I say it is like that individual prescription for some people is really important for their safety and well-being.
Yeah.
So it just depends what's going on, but I would definitely talk to an EP if you can. You can also, the beautiful thing about an EP is you can get them on your Medicare plans, just like a mental health plan. You can go and get a
Yeah.
few sessions for free or for a very small cost, and get an idea of what exercise is going to suit and benefit you best long term.
Because everyone's different, right? And it is
Absolutely.
important, like you said, for some people, it's just, could be going out for a 30-minute walk every day. And for other
Yeah.
people, it's getting your heart moving a little bit more.
And I
Everybody
think
is
that
different.
kind of depends on where your
Mm.
base is as well, like what you've done
Hmm.
previously, your history of exercise, what your body's
Yeah.
used to and capable of. The other
So
thing,
exercise tick one.
yes, the other thing you can do is take. There's bits and pieces that can help our cardiovascular health. Like
Hmm.
if you are on a statin already, you really should be supplementing CoQ10, because
Okay.
we know that statins affect our CoQ10. That is
And
also
a CoQ10 is something you can buy from the health food shop.
absolutely, yeah,
Yeah.
get it from the health food shop. What I would look for, there's a few different forms of CoQ10. So we ideally we're looking for one called ubiquinol, and that
I've
means
heard
it's
of
going to
that.
be
Yeah.
absorbed a little bit better than there's ones called like ubicarotene and other forms. So ubiquinol is, you'll pay a little bit more for it, but that is worth it.
And what does that do, Mel? Talk to us about what this ubiquinol or the CoQ10
Yeah,
does.
CoQ10 is essential for like ATP in the body, so production of
What's
energy.
ATP? Sorry, I'm layman.
Yeah, no, that's okay. So you have like essentially you have all these energy cycles in your body and they run on a fuel called ATP. And so
Okay.
CoQ10 is really important for that. For some reason, when you take a statin, it reduces your endogenous CoQ10 production.
Okay.
So we want to make sure that that's in there as almost like fuel for the ATP to function in energy in all the cells and look after all the mitochondria
Yeah.
and support your cardiovascular health overall as well. It's
And
a
even if you're not on a statin, would you still recommend
yeah, you
this?
can.
Yeah.
Yeah. So the only things with CoQ10 are it can thin your blood. So if you are
Okay.
on warfarin or something, we just need to be careful. And with your dosages, you're kind of looking at, if you don't have any risk factors, maybe you can just do 150 milligrams a day. So that's, the standard kind of dose. And we go up to 300 milligrams a day when there's statins or heart disease or,
Yeah.
cholesterol, those kind of factors involved. So I can supplement CoQ10 right now if but I may not need it. So if I take it and it doesn't really do anything, then I'm probably sufficient. It's not going to hurt, but it is one of the more expensive supplements. So if you don't need it,
Okay.
you don't need it.
Yeah. Right. It's a
But yeah,
waste.
yeah. So
Yeah.
that's really good. You can
Yeah.
also go and get a herb called hawthorn. Hawthorn, traditionally, we've always used it for heart health. So you can go and get that from the health food shop as well and take that. There's some really good quality brands that just make a pure hawthorn capsule. Exercise, you've got CoQ10, you've got hawthorn. The other thing is half of women, over half of women post menopause don't have their blood pressure under control. So they're not treated for hypertension. So I think, like, apart from doing those little things, getting a proper check and then being medicated if you need it is really important, because high blood pressure will cause a stroke essentially. That's a really easy fix, and most people don't have any side effects from that type of medication.
Yeah.
So
Okay.
that's I don't know why we're walking around with uncontrolled hypertension. We don't need to be. We live in this world where we've got great options to treat that.
So it's just talking about it, right? It's just learning
Absolutely.
about it. So
Education.
if women are listening to this, they can go, I'm going to go to my doctor. I'm going to get some blood tests. I'm going to get checked. I'm just going to get checked so that I know. Knowledge is power, right? So if they know these things, they can talk to the doctor, talk to the naturopath, go and speak to someone who knows about these things to get
Definitely.
checked, because there's something out there that can help.
Yeah, yeah. And most naturopaths do blood pressure. Like we will just do that as a base. Your doctor, nearly every single time you go, they probably do it.
Yeah.
And, be checking that. And if you do have any family history, so the key thing is that women pre-menopause are very likely to be fine. So I think that has kind of fed into that misconception that women don't get heart disease as much, because we don't in our reproductive years. So making sure that you keep an eye, you can get a blood pressure machine for home, from the
Right, wow.
chemist for like $100.
Yeah, right.
So like, just, you can even do that, but making sure that those simple, checks, it's not necessarily, cholesterol will come back in a blood test, but other than that, your blood pressure is your first and foremost check.
Yeah. So what I would like to talk about now is that, we're talking about if you've got high blood pressure and if you've got high cholesterol and what we can do about it, because there are obviously big issues with heart disease. What can we do to prevent that from happening in the first place? Is it hereditary? Can we not stop it? Or is it diet, lifestyle, which has got us to that situation?
Yeah. It's like column A, column B.
Okay.
Definitely genetics. They do not play into our favor.
Mm.
You can have genetic cholesterol that you can do nothing about except take medication. For
Hmm.
sure. You know, I went to school with a girl who we were in high school and her cholesterol was through the roof, and that was
Wow.
a genetic issue. So she had to be medicated from her teen years. My husband has genetic high blood pressure. So no matter what I did, I could not bring it down. And,
Mm.
you know, he is an exercise physiologist, so he is moving all the time. He had me. I've given him everything under the sun, and I still couldn't control it. So him and his twin brother are both medicated from you know, their late 20s for high blood
Yeah.
pressure.
Wow. Mm.
Very genetic.
Mm.
The thing about women is you might find that that genetic influence doesn't occur till postmenopause. You know,
Right.
that key
Mm.
kind of transition,
Yeah.
the reduction in estrogen will cause the genetic factors
Mm.
to kind of become a bigger issue or allow them to become a factor. If that makes sense.
Wowzers. It's fascinating because like I mentioned, I go and get my blood tests done regular every year. And when I went I went recently because I had that whole migraine thing, and so I thought I'll go and check everything, and I had my bloods done, and it came back with everything was fine. So, not having any, head issues, and I had MRIs and everything. The only thing was slightly elevated was my cholesterol. And I was really surprised because I have a really healthy diet. Everything is, there's nothing, I exercise, I do all the
Yeah.
ticks. So the doctor was great. And he said, don't be alarmed because it's just something to be aware of now. It's the issue is if you don't do anything about it and just ignore it, in 20 years time you could have a heart attack and die. And I was like, oh great.
Yeah.
So he gave me a list of foods
Yeah, cool.
which were high cholesterol to low cholesterol, and obviously all your animal foods.
Mm-hmm.
Prawns, I was surprised, was
Yes,
quite
prawns are
high
the
up on the
highest.
high
Yep.
cholesterol. And he just said for the next kind of 6 weeks, just try and keep away from any of the.
Mm-hmm.
He actually said try and keep under 100 milligrams a day
Okay.
of it. So because I'm an extreme person, I'm like 10 milligrams a day. I'm like trying to have no cholesterol, and then I'm going to go and have my bloods done next week to see if there's any difference. Because I was like, I want to know if that is something genetically that's happening now, or whether it's I've eaten too much chicken or I've eaten too many eggs or whatever it is.
I would say more so. It's really hard because I think improving your diet overall is
Mm.
so important for our longevity. But when it comes to cholesterol post menopause,
Mm.
it's like 1%.
Yeah.
It's really not gonna make a huge difference,
Right.
unfortunately. We
Right.
have too much working against us as it starts to
Yeah.
tick up. But the other thing for you is cholesterol, it's not the bad guy.
Mm.
It is a response to inflammation. So
Right.
you having had that horrible migraine
Yeah.
and having systemic inflammation from,
Yeah.
all of the effects that happens with that, it could put your cholesterol up a couple of points short
Yeah.
term.
Right. Yeah.
So cholesterol is a reading of inflammation. Your body releases it as a protective mechanism.
Oh, right.
It's like the lubrication for the car or the oil. I don't
Yeah.
really do cars, but something like that. To try and help with the inflammatory response. So it's not always a
Yeah.
bad thing. Sometimes we are too quick to bring it
Yeah.
down. So if there has been some kind of illness or, there's like a trauma or something has happened, your body will try and fix it. And
Yeah.
that's its attempt to try and do that. So that's why we wait, like your doctor's doing. He's doing the right thing by waiting and
Yeah.
seeing if that comes back down.
Yeah.
And or stabilizes. It might be
Yeah.
that that's your new cholesterol reading,
Yeah.
for a little while. As long as we don't keep climbing, so this is where
Yeah.
the regular checks kind of
Mm.
come into play
Mm.
and go over the I think they like to keep it at around 7,
Yeah. Right. I
Yeah,
can't even
for
remember what mine was, to be honest.
yeah.
I know it was just a little bit elevated, and I was like,
Yes.
"Whoa,
And a
whoa."
little bit elevated is a normal response and a great
Yeah.
response from your body to try and
Mm.
address the inflammation that's probably happened due to your illness,
Yeah.
cholesterol is also so important for us post-menopause because we don't have our estrogen anymore. So cholesterol is
Yeah.
a protective mechanism. It's still going to have a positive effect on our hormones. We just don't want it to get too low, too high, and we need to keep an eye on it to, as a preventative health measure to
Yeah.
check. And that's in combination with that blood pressure.
Yeah.
And, there are other blood tests that you can do, like C-reactive protein, that come into play, that your doctor can, do for you and read and put all that information together and then look at how you're presenting, and go from there.
Yeah, it's fascinating, isn't it? And I always think, I mean, I always talk about knowledge is power, but I think as much we can learn about all of these things, it kind of helps us kind of navigate through
Definitely.
life.
Yeah, yeah.
But the other thing I wanted to talk about is that obviously with Zing Wellbeing, we do an awful lot of meal plans, and
Yes.
we talk a lot about what meal plans can help, with food as medicine, and you've created so many for us already. But I'm always shooting you emails with ideas because I'm just constantly thinking of things. And one of the ones we're working on, or you're working on, and everyone's doing at the moment, is the high cholesterol one, which was really, spurred from my own experience. And
Yeah.
I thought, when I learned about that, I was like, we need a high cholesterol,
There's no
meal
prawns on
plan
it.
for women. Yeah. Because I was like, wow, I learned about cholesterol then, and I didn't realize as much as I definitely should have. So I thought, let's create that. We're doing a liver one,
Mhm.
because again, from your knowledge about, how important the liver is with menopause, and clearing that estrogen
And
out of
also
the body.
heart. The liver is really important to keep your heart healthy too.
Yeah, well, yeah, I know it's all connected, right? Obviously, the gut
Definitely.
health ones.
Mhm.
And then we're also doing the anti-inflammatory ones,
Mhm.
which you mentioned before. Now, when we're talking about heart health, is there any particular one of those that you would go, if you're listening to this, um, this one particularly would be good for heart health? Is it anti-inflammatory?
Mm.
Is it high cholesterol? Is it gut? Is it liver? Or is it, do one of each, one a week
You
for a
could,
month? What's the
yeah. Look,
best?
I think the
Mm.
anti-inflammatory one is probably one of the best ones because we're looking at really high antioxidant intake to support the heart
Hmm.
health and support all of your cellular health and, like I said before, that mitochondrial production. So that would probably be the best one. But by eating that, like, I say the diet's 1%, but that's if you have a diet that reflects what we're talking about here and those
Yeah.
meal plans. And lots of people do, which is why I think we've got to not be too hard on ourselves to, like, get
Hmm.
our cholesterol intake down to 10, which is 10
Well, I'm
milligrams.
like I said, I'm all or nothing. I'm an extreme.
Yeah. Because, like I said before, it's really important for our health too. And the
Yeah.
foods that may contain cholesterol, like meat, like red meat, will have other benefits. So, we don't want people to not have any red meat because they'll end up with no iron, no B12.
Yeah.
And that's your main source of CoQ10 too.
Yeah.
So it's about balance. It's about whole
Hmm.
foods. It's about moderation. And sure, avoid those really high cholesterol foods like prawns. Maybe having more, I think for Australians, the biggest thing that they can do for their heart health is reduce their amount of animal protein overall.
Hmm.
Little, like small amounts, we should only really be eating red meat once or twice a week. We don't need more than that.
Yeah.
And having plant-based meals, like, probably the majority of the time, or having like a pescatarian diet, so fish, more
Hmm.
fish. Yeah,
Yeah.
is
And we
key.
talked about this the other day about, um, meat's great. You don't have to not have meat. You just don't have to have it every
We
single
don't need
day.
as much as
Breakfast,
we.
lunch, and dinner.
Yeah, see, we're spoiled. We have all of these beautiful fields of cows in Australia, and so we just eat them
Yeah.
all the time. So we're kind of spoiled for choice there. And I think a lot of if I think back to what my mum cooked, it's meat. It
Mm.
was meat and three veg. Like
Hmm.
that's what I grew up on, and so a lot of
Yeah.
Australians, that's their go-to. So it's about understanding where we can get protein outside of meat,
Yeah.
and then that comes back to what you're doing. That your whole purpose is education,
Yeah.
so it's about
Totally.
finding other sources of protein to keep us full and satiated and keep us
Yeah.
healthy. And like I said on our last podcast too, you'll notice that with these Zing meal planners, there are There might be one meat, there might be one chicken. There's definitely going to be fish. Sometimes I do one or two fish, and there will be most of the other meals for lunch, definitely, and then for dinner sometimes will be plant-based.
Yeah, yeah, it's amazing, and it's great because I think that when you learn how to cook using other foods, it's kind of liberating because you're not kind of just going, oh my God, what am I going to have for dinner? Is it just chicken or is it just a steak? You know, because you do get stuck in a rut, and
Yeah.
especially, you know, if you've got a family and you've got to feed, you know, everyone needs feeding all the
Yeah.
time, and it's you know you can't
Especially
not feed
teenage
them, so
boys
it's
like you.
yeah, totally. So it's just really great because you learn so much about the foods. And what I'm obsessed about is learning about the, you know, the actual benefit to the food, because I really believe is that all of us, when we know the benefit or the non-benefit
Yeah.
of that food, will either eat more of it or eat less of it, or at least eat that non-benefit as a treat and not kind of see it as an everyday food, because
Yes.
it's not about punishment. It's not about, you know, seeing food as good or bad. It's just going, how can we fuel our bodies to live a long and healthy life? That's how I see it
Yeah.
anyway.
Yeah. It's about longevity, and it's
Yeah.
about, having quality of life in that longevity.
Yeah, absolutely. Well, listen, again, love today's session. I think that, you know, more women and men need to know about heart health. It's an enormously important topic. And I think that hopefully women listening to this today, you're going to go away, think about it, go and get checked, you know, and have heart health as a, you know, really number one thing to think about with our
Definitely.
health,
And like I've
because it is.
said, post menopause a lot during this session, but the recommendation is that women get checked from 40, start having
Yeah,
those regular
right.
checks.
Yeah, it's so important, isn't it? It's just when we get older, everything just starts going downhill.
A lot of appointments.
A lot of appointments. Well, thank you so much. It's been really interesting, and I really appreciate your time.
Thanks for having me again, Rhian.
Thank
Bye.
you. Bye. Okay, let's stop this one. Awesome.